You've lost 20, 30, maybe 50 pounds on a GLP-1, and the scale has never looked better. But what if I told you that up to 40% of the weight you just lost wasn't fat? In the landmark Step 1 trial with semaglutide, patients lost an average of 30 pounds, but nearly 12 of those pounds was lean body mass, muscle, water, connective tissue, the stuff your body needs to move, stay strong, and keep your metabolism firing. Now, before you panic, this is not a GLP-1 problem. This is a weight loss problem. It happens with dieting, bariatric surgery, and every major caloric intervention ever studied. The difference? Most people on GLP-1s have no idea it's happening, and even fewer know what to do about it. I'm Dr. Zepbound with Bespoke Concierge MD, and I'm going to give you the exact playbook built on data from a joint advisory issued by 4 major medical societies on how to protect your muscle while you lose fat on Foundeo, Ozempic, Wegovy, Mounjaro, or Zepbound. What I share in the last 2 sections of this video could completely change how you think about your treatment. Okay, let's dive in. Here's a question I get every single week. Am I losing muscle on my GLP-1? The honest answer is yes, some lean mass loss is expected. But the full picture is far more interesting than that headline. Meta-analysis show about 25% of total weight lost on GLP-1 medications comes from the lean body mass. Since muscle is roughly half of lean mass, about 12% of your total weight loss is actual skeletal muscle. The rest is fat. But here's what almost nobody talks about. There's a critical difference between muscle quantity and muscle quality. Your muscles aren't just fiber, they can be loaded with fat. Think of the difference between a marbled ribeye and a lean filet. Fat-laden muscle is weaker, more inflamed, and metabolically broken. In a post-hoc MRI analysis of the SURPASS-3 trial, tirzepatide actually reduced fat inside the muscles by 2 to 4 times more than what normally accumulates over an entire year of aging. And in a semi-lean study with semaglutide, patients' grip strength went up by 4.5 kilograms at 12 months, even as total lean mass dipped early on. And we all know grip strength is tied directly to longevity. Sarcopenic obesity in that group dropped from 49% to 33%. So yes, the scale weight of your muscle may drop slightly, but your muscles can actually get cleaner, stronger, and more functional. The question is, what do you do to maximize that? And it starts with one thing almost everyone on a GLP-1 is getting wrong. If there's one thing I need you to walk away with today, it's this. You're almost certainly not eating enough protein. GLP-1 medications crush your appetite. That's the mechanism. But when you're not hungry, protein is the first thing to disappear. You graze on crackers, maybe a small salad, or not, and your muscles quietly start breaking down. A 2025 joint advisory from 4 major medical societies, the American College of Lifestyle Medicine, the American Society for Nutrition, the Obesity Medicine Association, and the Obesity Society, set the target 1.2 to 1.6 grams per kilogram of your ideal body weight per day. For most people, that's 80 to 120 grams daily. Here's how to hit it when you're barely hungry. First, eat protein before anything else at every meal. Chicken, salmon, eggs, Greek yogurt. Protein gets the fork first. Second, spread it across 3 to 4 meals. It's a myth that your body can only absorb 20 to 30 grams of protein per sitting. You can definitely absorb more. Research shows that spreading protein across 3 to 4 meals throughout the day gives your muscles a sustained anabolic signal. One big dinner means your muscles go hours without the amino acids they need to repair and grow. Third, use a high-quality shake on days when solid food just isn't happening. And for an extra edge, 30 to 40 grams of slow-digesting casein before bed has been shown to boost overnight muscle repair. Check the link above for a deep dive on exactly how to optimize protein with Dr. Michael Edney, a former professional chef, registered dietitian, and board-certified primary care doctor. He's also my partner and best friend. It's a great conversation if you want to learn about the full breakdown on protein sources, timing, and meal planning. But here's a critical caveat the research is very clear about. Protein alone is not enough. Excess protein your muscles can't use gets converted to fat by your liver. You need it paired with the right kind of exercise, and that's what most people are missing. If you're only doing cardio, walking, cycling, the elliptical, you're leaving the most important tool on the table. Resistance training is the single most effective intervention for preserving lean mass during GLP-1 therapy. Studies on caloric restriction show that structured strength training can reduce lean mass loss by 50 to 90%. That number alone should change what you do with this week. The minimum effective dose from the research, 60 to 90 minutes of resistance training per week, split into 2 to 3 sessions. Focus on compound movements, squats, deadlifts, rows, presses, hip hinges. These recruit the most muscle at once and give you the best return on your time. Add 150 minutes a week of moderate cardio for heart health, but the cardio does not replace the weights. Aerobic exercise is fantastic for making your heart more efficient. You will lower your heart rate, be able to carry more oxygen, that's VO2 max, and develop a lot of endurance. but lean muscle from resistance training will extend your lifespan, pure and simple. Both have significant benefits and both deserve your efforts. If you're not sure where to begin, I've got a video walking you through exactly how to build a resistance training program from scratch, no matter your age. One group especially needs to hear this. If you're over 65, going through menopause, have low testosterone, or have been sedentary for years, you are at the highest risk. This is something we screen and plan for with every GLP-1 patient at Bespoke Concierge MD because it makes that much of a difference in their outcomes. Now, once your protein and training are locked in, there are 3 supplements with real evidence behind them. And most of what you see advertised online didn't make this list. First, creatine monohydrate, 3 to 5 grams daily. When combined with resistance training, meta-analysis shows it increases lean mass by about 1 kilogram and reduces body fat by an additional 0.7 kilogram compared to training alone. It also suppresses muscle protein breakdown during caloric restriction, directly relevant when your GLP-1 is cutting your appetite. I personally take 3 grams daily and recommend my patients take 5 grams divided into morning and night doses on the days they're lifting. Second, omega-3 fatty acids, at least 2 grams per day of combined EPA and DHA. Omega-3s activate the mTOR signaling pathway that drives muscle protein synthesis and reduces chronic inflammation that accelerates muscle loss. You need at least 6 weeks of consistent use before you'll notice the benefits. Third, vitamin D. The goal here is getting vitamin D into the optimal range of 50 to 70. For many people, that is about 800 to 2,000 international units daily. It's important to track your levels for proper titration. A large genetic study published in JAMA Network Open showed that levels below 20 nanograms per milliliter are strongly linked to sarcopenia and reduced grip strength. If you're deficient, this is low cost and well supported. I have deep dives on all 3 of these topics linked in the description. These supplements are the finishing layer. Protein and resistance training are the foundation. Now, what happens if you stop your GLP-1 medication? This is the part that should motivate everything you just heard. The data here is sobering. Studies show that after stopping GLP-1 therapy, patients regain weight at roughly 1.7 pounds per month. In the Step 1 extension trial, 2/3 of all weight loss came back within a single year of discontinuation of GLP-1s. Within 18 months, most patients return near their starting weight. But the weight on the scale is only part of the story. Here's a mechanism nobody explains, and once you understand it, the rest of the video makes complete sense. Every pound of muscle you carry burns about 6 calories a day just to maintain itself. Even while you sleep, sit, and do nothing, like scroll on YouTube while watching this video. Fat tissue burns only 2. That gap is small per pound, but it adds up fast. Lose 10 pounds of muscle over the course of your treatment, and your body is now burning roughly 40 fewer calories every single day at rest, permanently, unless you rebuild it, and it gets worse. When your body loses significant weight, it doesn't just lose tissue, it also adapts hormonally to protect against further loss, dropping levels of leptin and thyroid hormones, increasing hunger signals, and slowing overall energy expenditure. Research shows that about 60% of the reduction in resting metabolic rate after weight loss comes from losing energy-burning tissue like muscle, while the remaining 40% comes from those deeper hormonal adaptations working against you. So when you stop your GLP-1, 3 forces hit at the same time. The appetite suppression disappears, your hunger hormones surge back, and you're now running on a slower metabolic engine than before you started. And critically, that weight regain comes back primarily as fat mass, not lean mass, making the metabolic situation even worse than where you started. This is what we mean when we talk about body composition. You can weigh less than you did before your GLP-1 and still have a slower metabolism and a higher percentage of body fat than when you began, because you lost muscle you never rebuilt. At Bespoke Concierge MD, we track this closely in every single GLP-1 patient. Body composition, not just body weight. Because the goal isn't just a smaller number on the scale, it's a body that can sustain that result for years. I made an entire video breaking down the research on keeping the weight off long-term after GLP-1. Tap the card above for that. This is exactly why everything we covered today isn't optional. The protein, the resistance training, the supplements, they're not a bonus protocol. They're the system that keeps your metabolism intact and makes your investment in GLP-1 therapy worth it. The muscle you preserve now is the engine that keeps the weight off later. GLP-1 medications are genuinely powerful, but weight loss without muscle protection is incomplete medicine. Here's the plan. 1. Protein. 1.2 to 1.6 grams per kilogram of ideal body weight daily. Spread it across meals. 2. Lift weights 2 to 3 times per week. Compound movements starting the day you start your medication. 3. Creatine, omega-3s, and vitamin D as your support stack once the fundamentals are in place. 4. Track more than the scale. Body composition, strength, and function tell the real story. If you want a physician who monitors all of this, your labs, your body composition, your muscle health, not just your weight, that's exactly what we do at Bespoke Concierge MD. We build personalized metabolic plans for every GLP-1 patient because cookie cutter care doesn't cut it when the goal is keeping you strong for the long run. If you're looking to get started on your weight loss journey and aren't sure where to begin, we built a metabolic health and nutrition assessment to help you get started. If you're already on a GLP-1 and want to focus on building and preserving your muscle, the video on the right is my fascinating discussion on protein with Dr. Edney, my partner and chief medical officer of Bespoke Concierge MD. The playlist on the left covers GLP-1 medications and benefits in detail. And hit subscribe. I publish evidence-based medical content every week that could change your life. See you in the next video.